Hey, I wanted to answer a question that I get all the time, and I see it all the time in a lot of different ways. And ultimately, what you're asking is why won't my teams follow the systems that I have? And essentially, there's three big reasons why. Let's talk about the easiest one first as well. They're lousy people. Okay. I mean, I don't think that most people are lousy people, but there are lousy people out there. And what do we do when we have a lousy person? Well, we create an opportunity for them to go somewhere else and maybe find out where they'll be best utilized. You know, a square peg in a round hole just isn't going to work. So let's just get rid of that one. Now, the second reason that people really don't follow systems is basically because they don't know how to use them. It's a training issue. How well have you done with your training on the system that you're trying to get people to utilize? In a dental office, training is not something that, frankly, we really spend a whole lot of time on. And even when we do spend a lot of time on the training, we don't really have a good mechanism to decide if the person really got the training that we were trying to give them. And frankly, we don't spend a whole lot of money on training. The third reason that people don't really follow our systems is because they don't believe in them. They haven't bought into the system. The system that we're teaching people or asking them to use should really fall into one of two criteria. It should either be better for them, it should make their job easier, more enjoyable, more profitable, whatever, something like that, or it should be better for your client, for your customer, for your patient. If it doesn't kind of fall into one of those two categories, then it's really going to be difficult to get someone to buy into it. So is it better for them? Does it get them out of the office on time with more regularity? Does it increase the patient satisfaction? Does it increase the end result for the patient? Does it drive the mission of excellent patient care in a professional and comfortable setting? And so if it does one of the two of those things, then buy-in, kind of should be easy enough. So remember, the first one, lousy people, we know what to do with that. We create an opportunity with them. I usually tell people that, hey, we can still be friends. We're just not going to be coworkers anymore. The second one is training. So look, training. It's really important. And I would say train in groups. Try not to train individually if you can, because the message just comes out different every time. So make sure that you're training well, that people have the tools, training, and resources. I call it the TTR, tools, training, and resources that they need to be successful. And then again, the last one is that are they bought into the system? And how would you know if they're bought into the system? Well, you got to ask them, do you think this system is a good system? And then let me just throw one little caveat in there about systems is in order to create a great system, it really requires collaboration from the people that are going to be utilizing the system. So make sure you give the people that are going to be using the system the opportunity to give their input, their feedback, and then that's especially another great way to get them to buy into the system because, let's face it, they've got some skin in the game. So everybody believes that we've got the best system. It's going to either be better for the customer, client, or patient, or better for the person that's utilizing the system. And then it's a matter of training and executing, doing some refinement, and then you have the ability to hold people accountable. So there you have it. Those are the three basic reasons that people either do or maybe don't follow your systems. Hey, I hope this video has been some help to you.